I would like to welcome our three panelists for the program today, and also to introduce them. Who's a fourth-year medical student. I'm not going to tell you very much about them because kind of talking about their story is part of what's happening with the panel today. And then Angela Miney-Nugent, or Nugent?
Just Angela Miney is fine.
Okay. Who works as a patient and family advocate for the Department of Pediatrics Pulmonary Division. And then Edna Heinzen, who currently lives in Okemuk. And all of them have really interesting stories to tell. And so I guess in the process, feel free to talk more about yourselves and the things that you feel would be relevant and important for the audience to know. But I'm going to ask them to respond to some questions, and then with time afterwards, we can take questions. So starting with Edna, what has been your personal, and then we'll just move down personal or family experience with navigating health and healthcare as a patient?
Sure. I've been very fortunate in connecting with the healthcare that I need, except in the area of my brace. You young people, I don't know what you know about the polio epidemic, but it's something you really should review, the history of that. And like 24,000 people had polio in 1946, the year I had it, and 53,000 had it in the early 50s. And we never know when a virus might come back again, a major. So we need to keep the history of how that affects individual lives, family lives, nation, political, social, emotional, so we'll be prepared if it does happen again. So the area that was difficult for me and continues to be difficult is orthotics, having the appropriate brace with the lock that works well for me. And as the years go by, people forget about people who had polio, or we now are into post-polio syndrome, which I hope you'll hear something about maybe in another class. But that's been my main concern, is receiving the type of medical attention that I need related to polio.
So my experience with healthcare is really through my daughter for the most part. I have a 23-year-old young adult now, and when she was 6, she was diagnosed with what turned out to be a complicated form of juvenile arthritis. So she has systemic juvenile arthritis. And naively, when she was first admitted to the hospital all those years ago, and they said she had arthritis, I said, okay, that's great that you know what she is, so fix her now, and then let's get back to what we were doing. And I learned over the years that there was no going back, that we had a new normal and a new reality. So she has actually, in all of that time, up until about 9 months ago, she was getting all of her care here at Shands. She is actually a UF graduate. So she graduated last May, and because her illness is relatively, it's not rare in the rare form, but it's not that common, the form of arthritis that she has. Her pediatric rheumatologist here said, well, if she's going to go to UF, I'm happy to just kind of hang on to her and continue taking care of her while she's here, so that you don't have to worry about, finding new providers. And why would I have objected to that? I've had this relationship with this person all these years and continue to have that. So, so my interaction with healthcare has mainly been in pediatrics with Catherine, and just a tiny anecdote. So Catherine, when she graduated last year, got a job in Utah and has gone off to Utah, and coincidentally, right this minute, she is in her first appointment with adult rheumatology on her own, and I'm not there. So it'll be really interesting to hear what happens with all of that. And I was talking to her briefly last night about talking about kind of navigating what I was trying not to be too intrusive, but saying, you know, maybe you could ask them this and ask them that. See whether you like them and hope they like you. So that's my interaction with healthcare. I'll tell you more about that as Nina asks us more questions. And then I have a professional role, which I'd also
I'm a fourth-year medical student now here at the University of Florida. I was diagnosed with cancer my first year of medical school, and it was a very unique experience because being a medical student and being a patient, I think, has taught me a lot. My interactions with medicine include taking care of people who have the exact issues I'm dealing with, as well as going through the steps myself and the worries that come with it. It's just been very unique. I think the biggest interaction I had that stands out to me when it comes to interactions with medicine is, as a patient, I knew something was wrong, but no physician would really listen to me. And they're like, "You're fine, you're young, you're healthy." And even though I continually sought medical care for a little lump in my neck, everyone kind of dismissed it. So I think that if I wasn't in medical school, I wouldn't have pursued it further. And I think that was probably the biggest impact, because all of our cases started with there was a lump. So you start, you know how they say you think you have every disease that you read about when you're in medical school? Well, I think that's the reason why I was like, someone needs to do something. And if that wasn't true, then I wouldn't have gotten diagnosed when I did, and it would have been dismissed further. So it's my interaction with healthcare as a patient.
And I'm actually going to go off script a little bit. I sent these folks the questions, and I think you all are okay with answering questions from the group. Since I know them all and I've worked with them, and I know their stories in greater depth, there's a lot of richness that hasn't yet come out. So if it's okay with you guys, I'll open this up for some questions about their illness experience from the audience. We'll talk more then about how that maybe caused them to choose a profession or develop a professional approach. But just if there's anything more you want to know about their experiences with illness.
I would love to hear more about your sort of your polio experience. How old were you, and what was your care like when you first? Because that's just, to me, I'm like, I've never met anyone who hook up like my grandfather managed to avoid it and things like that. I feel like it's just such did they know right away, and were they able to were you getting good treatment from the outside? I guess is my question.
Well, your comments excite me, and I'll tell you why. Nina and I have been working on a project for 6 months or more. My mother kept a journal from 1946 to 1951 of care, the doctors, how our family interacted with this going on. And to me, it's a very exciting historic document. I mean, you wouldn't want it for your evening read for this chapter, that. It's a real journal, and you know how journals read. So, but anyway, we're hoping, we don't know, but we're hoping it will become a book and that you'll be able to read it. We do have 3 copies of it. The original is in the Smithsonian because in 2005 they had a major exhibit. Do any of you remember that? When it was the anniversary of the Salk and the Sabin vaccine. And my mother saved everything from our polio experience. Cards, letters, everything. And the Spalding Institution, we connected with Harvard, connected to the Smithsonian, wanted all that information for the exhibit. So I had madly tried to preserve what I could of the journal before I sent the original off to the Smithsonian. I had polio in 1946. I was 6 years old. I was in isolation. The whole nation was terrified. They were so afraid that their family member would be next. And sure enough, it happened to my family. I was in hospitals in and out from 46 to 51. I missed years in school. I blame that on my poor spelling. I've had a very productive life. I have a master's degree, special ed. I've won honors for Lake City Community College in the area of disability. But ask me some questions, or should we move on?
Well, I just one more clarification. I want to steal all your time. Well, which Smithsonian, which building is it? So like the
American.
History. Okay.
But now that was only for that certain period of time.
Right.
All of that is moved, I say in dungeon or whatever. But you don't have easy access to that journal.
They preserve
So
it.
that's why. The other thing I might mention to her, my mother wrote that in a strange way. She wrote it as if I'm talking, my voice.
Oh, wow. Interesting.
And we don't think there is another journal like that. And a research that Nina and I both have done, they have said most of the journals or stories were told after the person became an adult. This is a recording as it happened, not just temperature and that sort of thing. It has to do with where the family was and what we were doing, what were the problems, how did we solve them.
Thank you.
Sorry, I talked to you.
I love hearing
And I'll interject that you grew up in Lake City. So she's from North Florida, and she also was had some treatment at the Warm Springs facility in Georgia, which is what FDR set up for treating polio.
Was your mother a writer? I mean,
No.
in her day job kind of thing?
No, she was she was a national worker volunteer with the March of Dimes when I had it, and she had meetings with Helen Hayes. Too young to know who Helen Hayes is, right? Sorry, famous actress.
I just wondered, I mean, it takes a lot of discipline to keep it.
No, she was just like that. She just felt like I need to record this. And I'm not going to put it, I'm outside looking in at her in isolation. But I'm going to write what I think she's feeling, or I'm going to ask her. So it's really unusual.
Could I make a comment about something earlier when you talked about when you knew that there was something wrong with you and you couldn't get people to listen to you or take you seriously? That really reminded me of last year when Catherine had her last appointment with Peds Rheumatology, and we were talking, the provider was talking to her about, what she should look for in a new provider. The one piece of advice was you need to find somebody who will listen to you. Because, she was coming with this whole story of the past 16 years. And the provider was saying to you, you know this story better than anybody else, and you really need to have somebody who will listen to you. And it's, and I was texting her that last night. I said, I hope they listen to you. And not just, come in with sort of the preconceived idea in their mind as to how they were going to continue to treat her.
We also have the same thing with post-polio syndrome. I saw some heads nodding. Are you familiar with post-polio syndrome? We couldn't get the doctors to believe us.
Yeah.
And now they know.
And basically, post-polio syndrome, many people who had polio went through rehabilitation and regained a lot of the movement that they had lost right after the polio struck. And so they were able to walk around and everything, maybe not 100%, till they started to get older, and then they started to lose a lot of the function to kind of go back to that earlier state when they were first recovering from polio. And I think a lot of them were told, oh, you just have a cold or you're just getting old. But it's significantly different. Lauren, you had a question.
So I have a question. So, how old were you when you first started experiencing symptoms, because I had thyroid cancer myself, so I'm very interested in your experience. Because I think when younger people get it, you're like, this isn't supposed to happen to us. So I was just more curious about your overall experience, and like, I guess go into more like the struggle of trying to convince someone to believe you that something is wrong.
Yeah, so it was the first year of medical school, so I was 23. Yeah, I can math. So before medical school, I had a lump. And I actually saw 2 providers here at the University of Florida, and I got ultrasounds, and they were like, it's fine, you were sick. I kept saying over and over again, but I really wasn't sick. They were like, you were sick and you didn't know it. Or you have some sexually transmitted disease, like mono or something that would cause your lymph nodes to be swollen. I said, oh, like, I'm perfectly healthy and all the tests are negative, so something else is going on. They're like, well, you're young, it's fine. Lots of people your age have lymph nodes, and they were very dismissive. So then that was the year before medical school. And then 6 months before medical school, I called a second provider and I'm like, it's not going away. They also got an ultrasound and didn't do anything about it. They didn't even call me back to tell me the ultrasound results were normal. They were like, it's fine, you're being crazy. The other doctor told you you're fine. I actually also went to Equal Access Clinic, because at this point I was just trying to get someone who would talk to me, but I didn't want to spend a lot of money because I was poor. I'm still poor. But, so I went to Equal Access, and then they were like, you're fine, calm down. So I went from like multiple doctors, which kind of looks bad, you know, like the doctor hopping is like not supposed to be a good like sign. And so finally, during medical school, so I was 23 and finished. So it was December where I went home for a preceptorship, where I kind of like you go into a local physician's office, family medicine or peds, and do 2 weeks with them. Well, I passed out twice in his clinic, and I kind of blame it on I saw circumcisions for the first time, so that was kind of like emotional, but at the same time it was like very unusual for me to kind of react that way. So I'm like, that's interesting. So I went to student health here, and surprisingly the person that listened to me the most was a nurse. She was a nurse practitioner here at student health, and she was finally like, okay, well, let's stick a needle on it.
She was the first one to suggest a finding
well, yeah, she got the ultrasound first. And she's like, you know what, let's just stick a needle in it too. So on January, when I came back from preception, she got an ENT, she referred me to ENT. That's all it took was a referral to ENT. They stuck a little needle in it, the diagnosis came back, and then that's kind of history. But as a future physician, like, I got dismissed by 3 physicians. Finally, the person who really stepped up to manage my healthcare was a nurse.
Sorry, nursing library.
So I think that it shaped me a lot personally in that way. I did the standard care for thyroidectomy with bilateral radical neck dissection. And looking back now at the ultrasounds that I got, like I got 3 ultrasounds before medical school started, and they're all swollen lymph nodes on the left. And I'm just like really? Like if I saw that now, I'd be like, let's stick a needle in it. Because like normally when you're sick, you have it bilaterally. The other thing is at the time I still do a lot of fostering with animals. So the only other thing that I could Dr. Google, right, find is that if you have one-sided swelling, that can be common for cat scratch disease. So I'm like, all right, cats bite me all the time. I have cat scratch disease, so let's get those tests done. So actually the person who did that again was, even though I went to doctors like, could this be cat scratch disease? They're like, nah, it wasn't, which would have been better than what it was, but something as simple as that simple blood work that would have told me it wasn't Cat's scratch disease was easy enough to do, but I couldn't get it much later.
And through all of that, were you kind of continuing to function? I mean, to kind of get through your day and...
I think it depended on the day. So without sounding like, I don't know, I was a very high functioning person. I got into medical school, had tons of energy, never struggled with anything ever. And it's amazing how this one thought has caused such a major ripple effect. To me taking time off from school, which, like, if you would have told me I was going to take time off from school, like, before medical school, I was like, oh, like, and it's really impacted that. Being so, are you tired because you're in medical school, or are you tired because you know, I have a thyroid? And all my classmates are like, they're exhausted, and I look at them and they look exhausted, and I'm like, well, am I more exhausted or less exhausted? And like, where do I stand? It was difficult in that aspect, but I did see a significant difference in academic performance, going from the very perfect straight A, 100%, easy peasy, to really having to earn B's and work really hard for to stay up with that. So I think that's probably where it takes me out the most.
I asked that too because with Cat illness, for example, you couldn't ignore it, or you could ignore it for a few days, but then it's like really high fevers, and they would become higher, and she would feel sicker and sicker, and so typically she would end up in the hospital. So it wasn't like she could just manage these symptoms. And, I mean, people, they couldn't ignore it.
Yeah.
Which helped.
Yeah.
I think we were in the doctor's office all the time, or in the emergency room, or wherever.
The squeaky wheel.
Until we figured out how to control it.
So I'm going to kind of move on, although, again, there's more that I would love to hear about your experiences. But, and we've heard about this a little bit, especially, how has that experience or how did that experience inform the way you approach your profession?
Okay. Well, in looking for brace or looking for products, and being a coordinator of disabled student services at Lake City Community College, I thought we need a directory. So some friends and I decided to canvass our community and where can a student get glasses, where can they get braces, where can they get crutches, the name, address, phone number, and as you know what happened, it became dated very quickly.
Yeah.
So, but now with computers, see, this is before computers, but the directory was a major part of how my experience helped me know that these students need more help finding the medical services they need in rural North Florida.
Well, I had no interest in healthcare whatsoever, and when Catherine got sick, I really didn't even want to be. I often say I was dragged into healthcare kicking and screaming. I had no interest in it and was not happy when she got sick. And actually, it has provided me now with a career. I have to, sometimes I rail against the fact that she had arthritis, and then I have to thank her for opening all these doors to me, because it's really what she has done. So I have a position in pediatric pulmonary now. Within pediatric pulmonary, we have a federal grant that comes from the Maternal and Child Health Bureau, and they are very patient and family focused, and at its simplest, I have a role in pediatric pulmonary at the table with an interdisciplinary team as a parent, bringing my perspective as the parent of a child with a chronic illness to that team. And in that, I get to interact with the faculty in just bringing my perspective. And so I sit in on all of our clinical meetings where we're discussing patients, and we can be discussing various challenges with a patient, and I can say, well, you know, from my point of view, have you thought about this, or why isn't, I mean, this is nothing clinical, it's sort of, you know, why aren't people adherent, why don't they take the medication as it's prescribed, and I can say at its simplest, well, have you assessed this person for literacy, or have you thought about the fact that, you know, they don't have access or they can't get to the local pharmacy, or, you know, what are their transport needs. And then this is the grant that we have is a leadership training grant. So, for example, we get disparity students who come and do a rotation with us, and we get other disciplines, graduate level, social work, dietetics, medicine, pharmacy. They come through and do rotations with us, and so I get to interact with them. And I think this is a really unique role within this hospital, and kind of nationwide. There aren't that many people. There are more opportunities now for patients and families to give their perspective and lend their voice to institutional change, but very few of us actually get paid to do it. Yeah, I am happy to say I get paid to do it, which is a very valuable. I mean, I compliment my colleagues for making that decision. I mean, it was a very risky decision. I've been doing it for like almost 10 years now, and 10 years ago to say that you're going to invite a patient into your safe space and to air your angst, and, it was very risky, and I kind of...
So I've told you a lot. I find myself saying, like, just because I don't know what's going on doesn't mean I don't believe you a lot. To lots of patients, lots of people in lots of different situations. After my surgery, I had all sorts of crazy stuff going on that I had no idea how to handle, and weird things. There was at least 3 or 4 months where I had like this sharp pain in my cheek every time I took a sip of water, and or try to eat or anything, and my doctors were like you're fine. And that has nothing to do with the surgery. Well, it started 2 days after the surgery. I'm pretty sure it has to do with the surgery. So I tend to think that medicine has its limitations where we don't have the answers to everything. So I just say that a lot.
And so the next question is kind of expanding on this, but I'm going to maybe target it a little bit for each specific person. And it's basically, so how have you worked to promote the patient voice in healthcare? And that's kind of come out a little bit, but wanted to ask maybe more specifically about your job with Lake City Community College. Was that something, how did you get hired into that, and how did you kind of serve as an advocate for students?
Well, how did I get hired for that? Actually, when I applied, since my master's is in reading, I thought that's why the president of the college called me in. And she said, no, this is not in the reading lab. We need you to be a coordinator of disabled student services. And I'm going, oh, wow. You know, a dream position for someone who has had polio and had to get through the university before ADA, Americans with Disability Act. So I thought, this is meant to be. I can help each one of these with vision, hearing, speech, mobility, blindness, all of these different disabilities to get through what was so difficult for me to get through. And I was able to work one-on-one with them about being their self-advocate. We'll sit down and talk about what is it that you need to take biology and what's the problem. Well, the slides, I can't read them. Okay, how can we solve this? I'd like you first to go and talk to your instructor on your own. And I'm here, call me if there's a problem. I've got plenty of Kleenex if you want to cry. And then if you can't solve it, call me and we'll go together, you know, to see if we can't work out an accommodation that you need and that's acceptable with your academic standards. So that was my job really at Lake City Community College, is how can I prepare them here for the real world. I don't want to pity, I don't want to baby, because the real world is difficult. And but you can practice here and feel comfortable in my office, and I will listen to you. But you are responsible really for your body and what you need, and you need to learn to be an advocate. Does that kind of explain? It's pretty close.
And so I guess with Angela, I'll basically you were part of creating this program. Do you want to talk a little bit more about what's happening on a broader scale?
Yes. So I started doing this very much part-time and really just bringing my perspective. I think, you know, that they didn't have any patient involvement back 10 years ago, and in pulmonary, one of the questions that they sort of grappled with was whether they would take the parent of another pulmonary patient, or whether they would just look for a patient who got their care within, you know, Shands Hospital, or UF Health as we call it now. And ultimately they ended up taking two of us. One was the parent of a child who had cystic fibrosis, so very much a patient in their clinic, and then me. And because I was not, or Catherine was not a pulmonary patient per se, there was a little bit of distance. So I think initially that really helped, because I felt better able to be outspoken about some of the things that I saw, safe in the knowledge that I was then not going to be in a clinic situation with, you know, bringing my daughter to see one of these people and worrying about her care being compromised because I was being outspoken. So we really just started like that, and as I say, it was very part-time, and then the other woman who was working with me, she did it for about 1.5 years, and then she got a full-time job and moved on, and I stayed. And because I was a rheumatology patient, I started saying, well, it's really cool that here in pulmonary you really want to hear what the patient voice is, and you really want to hear the patient perspective. Why aren't we doing it everywhere else? I mean, you guys have an interdisciplinary team. Why isn't there an interdisciplinary team in rheumatology? You know, in one sense, why aren't we getting the same services that you're able to offer here? Well, of course, you know, this federal grant really helped, which they didn't have, and money, as I learned, always helps. But because of that, I started then going out into the hospital and trying to find, you know, what we call our champions. So people who are also interested in patient-centered care and trying to find a place for the patient's voice. And, you know, there are so many kind of serendipitous moments that happened. You know, Catherine was admitted onto the general service at one point, and I met Dr. Nicole Black and had a conversation with her and said, oh, you're doing patient-centered rounds. And she said, how do you know I'm doing patient-centered rounds? And I said, well, I've seen the Cincinnati videos. And so that started a whole collaboration, and we got money to start a patient advisory council in the Children's Hospital, and then from that we connected into other people, and then we, you know, the hospital started an overall patient advisory council. And one of the things that has been said to me over the years when I have said, you know, you really should give other people the opportunity. There are lots of parents or patients out there who are very articulate and, you know, can be professional, and they're not just coming to complain about the care that they got yesterday in a clinic appointment. People have said to me things, oh, you're so unique, you know, there's nobody else like you, you're the, so for a while I was the token parent and on every committee in the Children's Hospital, and I said, you know, I'm really flattered that I have this position, but you really need to trust in other people and bring in other people. And then I started thinking about, you know, I mean, I've had the opportunity to go to various conferences, national conferences and things, and I started thinking about how great it would be to bring more people like me together, for example, in the state of Florida. Because people were saying, well, you're the only one, and I was saying, you know, I'm not that unique. I can't be the only one. And so about 2 years ago now, I ended up having another serendipitous conversation with people in the Department of Health at CNS, and they came back and offered me money to start a network of Florida family leaders. Not money to me per se, but gave me the resources to help develop that. And so last year, we had our first summit meeting in Orlando, and we brought together 82 people, 45 of whom were family leaders, so people who are in roles very similar to mine, either in paid roles or they are in what I call like super volunteer roles. So they're volunteering their time, but they are on hospital boards or they're working very actively in healthcare to try and improve care for themselves or their children. I mean, I'm primarily working within pediatrics, so they're mainly caregivers that I'm working with. So this is a really exciting initiative to me. And at the moment now I'm planning, we got funding for 3 years, so I'm planning this year's summit and finding more and more connections and more people out there who are great either self-advocates or they're parents who have had to advocate for children that they never realized would need service. I mean, none of us dream that we're going to have a sick child or want to have a sick child. So they've had to become advocates in areas that they really didn't ever imagine wanting to. It's very satisfying. But I'm not banging my head against the wall trying to And I do have days like that too.
Any further thoughts on this? Okay. And so I guess maybe a general question, although obviously, of course, if you have personal experiences that you want to bring in, feel free to do so. But overall, how do you feel that empowering patients, especially through bringing patient voices to the table, really improves healthcare?
Do that again, make sure.
How do you feel that empowering patients, like giving them a voice in their healthcare, having their voices be heard, how does that improve the delivery of care?
Okay. That is terribly important because often we will tell students what they need and they'll sit there and nod, but do we stop and ask them, tell us what you need? So I can't think of anything really more important because, as I said, it's their body. And they may not even agree with the health care we're talking about, or the bracing, or the glasses, or the hearing aid. And they need to tell us this works and this doesn't work. And they need to have a voice, for sure.
And I guess for you in particular, just kind of given the way that your mother created that diary, how do you think she was giving you a voice when she wrote the diary, as from your perspective?
It's really amazing. She was listening to me. If I think there's one word we want to remember today, it's listening. Not just hearing, but listening. And she was listening to me when I would say, who are these people in these dark outfits? They're nuns. Well, wasn't. And they're coming in and then with spinal taps and all this sort of thing. She was recording what it must feel like to be in that situation, which is very unusual. But empathy she was showing. But she was listening to me.
I mean, I just think what you have said is so important. So to listen to a patient, or in your case when you're working, to listen to your students and giving them a voice. And it comes down to, if you just talk at people, chances are they're not going to do what you're asking them to do for lots of different reasons. For either reasons because they can't get access to the care, or they're not as invested in it as much as you are, or whatever. But I think that elevating that then to the institutional level, just bringing the patient voice is another perspective. And I think that we've all recognized now that healthcare is really complicated. And, I'm sure you, Tisha, have talked about the various specialists that you've seen, or the different doctors that you've seen, where people were, they didn't know, but they were afraid to tell you they didn't know, or for whatever reason, and so you went to different people. So in one sense, you're the coordinator of your own care. Well, I and Catherine were the coordinators of her care, and it's really important. Before electronic medical records too, so often I will be filling in the gaps of, well, this is when she saw X, or this is what happened during this hospitalization. And so it's really important for us to be able, well, we also have to engage. So we have a responsibility if as a parent or as a patient, we want people to listen, then we have to be actively engaged in our care.
That's the next word.
Right.
You listen, and then what action?
Right. Yeah. But then I think
options, not just inaction, but options.
And agree to the plan.
Right.
So we're all working in partnership with one another. I think that's the really important thing. And all I try to do with our institutional leaders is to say, I just want you to listen to it from my point of view. It's not like I'm saying what you're doing is wrong and you should be doing it the way I'm doing it. I just want to add another perspective. And I think that will improve healthcare overall. Because if we're doing it at every level of healthcare, I'm really appreciative of being able to be here today and talk to people who are immersed in healthcare, or the chances that I get to go and talk to students or people, the emerging professionals, and say, I just want you to hear it from my point of view. And when you go into your professional roles, then ask where the opportunities are for the patient voice. That wasn't happening 7 or 8 years ago. So we really have come a long way to go.
Kind of going off of the theme here is listening and hearing. They say that hearing is having a conversation and in your head preparing what you're going to say next. And that listening is actually just listening to the words without coming up with a counter argument or anything to come right back. It's just being in the moment. Well, in medicine, we're paid to listen, but we really hear because we're diagnosing. That's our job. So while you're talking in my head, I'm rattling through the hundreds of textbooks, pages, and slides, coming up with the diagnosis. And that's what I'm supposed to do, but it doesn't really always round off that 100% that you really want to be a good physician. So I think a balance between listening and hearing in medicine is coming. I think that it's on the rise, and more doctors are, you're here, you need a diagnosis, and I'm going to send your way, but at the same time, I'm going to make sure to take that extra few minutes to make sure you feel that you've been listened to.
And that kind of feeds into my second question, is what has changed since you've been involved in healthcare?
Oh my goodness, have we got a few hours? It's amazing what Americans with Disability Act has done. It's incredible. Not just in the university level, the community. I'll try to make it short, but before Americans with Disability Act, there were no handrails at Florida State University, and you had to go down the cement steps like that to go into the chemistry lab and go back up again, and no handrail. And This doesn't happen under ADA, Americans with Disability Act. And that's just one little example. But can you imagine right over there, let's pretend like there's no handrail, and you use a brace or crutches or back brace, and you've got to get into a class in that area. And after doing that several years, if you're not careful, you begin to feel very rejected, like we really don't care what your problems are. So ADA has helped change that at the university level, in the community, in the hospitals, in every area. And they ask for reasonable accommodations. We're not asking you to change the whole building. We're asking you to change could you add, that handrail over there would make a world of difference to those, not only physical, but those with the vision problems too. But I could go on and on what the ADA has meant, and how did it get started at the base level, one-on-one, one person like me, as a freshman, and being a senator at Florida State, I had a chance to bring things like that out. Of course, it was just a little voice back then. Okay, let's go on to the next thing on our agenda. But it has to start somewhere. And look where it is now. Look at the change in the world. And not only here, but they're starting to change around the world.
So I would say, apart from kind of medical advances and physicians now being taught to listen more than just hear, for all its faults, I mean, there are provisions in the Affordable Care Act that were really important to me. The fact that Catherine could stay on our insurance until she was 26, that there's no discrimination now against people with pre-existing conditions. That, I worried about when she would graduate. Of course, I shouldn't have worried about this because it all worked out, but, I worried about when she would graduate, if there was a gap between her, getting a job or wanting a job that didn't have health insurance, what were we going to do about all of that? And there were no options. And so now, for all its faults, and I do know that there are lots of faults, there are options now for getting health insurance if you're not within the employment realm. So, I think I was actually talking to this with a group this morning where we were talking about sort of the challenges of chronic illness and healthcare, and insurance just adds a whole other layer of complexity to that, and a whole other layer of worry for parents in particular. So that was one thing. And then I was here when Epic came. And we had one physician, the chief in our division at the time, who, stuck with it for 6 weeks or whatever, and said, I was very close to retirement, and said, I just cannot do this. This is just not the way I was taught to practice medicine. They didn't teach me to type, and I just cannot do this. And, people just, at the time when Epic was first introduced, it was a nightmare for a lot of people. But I actually love an electronic medical record because it meant when we went from rheumatology to primary care to neurology to PT, her entire record was there, and I no longer felt responsible for keeping every sheet of paper and asking for every lab result. And so I like the electronic medical record. I think that has made a huge difference for people. I would like it to be more portable. I would like patients to have more access. I was talking to somebody the other day about patients being able to see their notes, on my chart. And I went, you ever see what we see on our end? It is, because I can see, within pulmonary, I can see the notes, and I went, that's not what we're seeing. So why can't people say, oh, well, we can't let patients see what we're saying about them? And why not? What are you saying that you don't want us to read? This is how I can be outspoken in our division. I can talk about these things all the time. They just kind of nod their heads now. So, yes.
Well, going off of what you guys said, my chart. My chart's pretty new. When I started, I didn't have it, and now I can see my results. I can see lab results. It may be minimal, and you're right. Maybe I would like to see. Maybe I wouldn't like to see my whole chart. I don't know, but at least there's more access. And now, I didn't realize this until I was with a recent physician in family medicine at Hale. She was answering her messages, and I just assumed that it's internal kind of messages, and I'm like, what are you doing? And she's answering the MyChart messages. The people
From patients?
from patients directly to the physician. I just in my head assumed they went to like some
inbox.
and some inbox or some lab manager, and then maybe at most the nurse. But these were direct messages from the patient to her through MyChart.
I think that's her choice.
Yeah, that's
Have
her
them
choice.
direct it to her.
I had no idea that that was a thing, and I was like, so I need to be a little more polite when I write these messages. Because apparently they're being read, and now I need to be like, good evening, doctor. So I didn't realize that. I just was like, need refill, thanks, bye. So,
Text message.
yeah. So,
There's a person that you're.
there's a person that you're directly interacting with.
Is that like chat?
It's like email.
It's an email.
You go online,
email,
you
okay.
log into the website that's like MyChart,
Yeah.
and it gives you like upcoming appointments, what medication you're on.
That I understand, but do we have chat in the medical area?
Like instant chat? Like,
Yeah. Like I go in and I don't know where to go for orthopedic area. And this person pops up and says, hi Edna, what are you looking for? How can I help you?
No, but that'll be next week's thing, because that's a really good idea.
Well, the library does that, so.
Yes. Are we paying attention to what industry is doing, what banks are doing,
Yes.
what credit cards are doing, what else?
How can we be more responsive?
Yeah, and you say, oh yeah, we got to pay this person, but can't we have interns or?
Well, that's like the way that I worked at a hospital, and what I liked about it was like, a lot of times when you call a number, you get taken to a phone tree, and you have no idea how to navigate that.
Exactly, and you do.
Right. And so what I liked about this hospital I worked at in Seattle Children's out in obviously Seattle, the way that it works is if you could dial, I literally could dial the main number for the hospital right now, and if you do, you get a person, you get a switchboard operator. You got me as well as working there as well as in grad school, because it's you just need a high school degree, you don't need anything fancy. And while we would we would transfer you to the regular clinic, and yeah, most of the actual specific clinic numbers were phone tree. You knew if you ever just dialed 0, you'd get a real person again. And we would actually even tell them, oh, you need to schedule an appointment. When the phone tree comes on, press 5. We'd tell them how to navigate it, because we have some people could just figure it out themselves, and that was fine. But if not, we were always the backup, and I always kind of appreciated that personal touch. And I know it's tough because it's expensive to hire a bunch of people. If there's just to answer the phone.
But there's a way to do it. We just haven't figured it out.
But look, the thing that frustrates me a little bit in a big institution, this happens here. So for example, in neuromedicine here, they have volunteers who meet patients either in the parking lot or in the atrium area, and they escort them to their appointments.
Very good.
But that's only, so why aren't we doing it everywhere? So and they've done research on this, and they've shown that it gives people a really good patient experience and improves satisfaction scores. So we need to figure out how this can be an institutional policy. The person who is ultimately in charge of wayfinding in this organization is really good at engaging patients and families in that on committees. And if you notice in the hospital, there's this metro system now, and there were patients involved in that. But we're still at the point where we're relying on kind of champions. So we're relying on people in different divisions or people who are just interested or sort of Nina, inviting us to speak as opposed to it being kind of hardwired into the system. And if somebody leaves, what happens is a lot of the time people leave and then their idea leaves with them. So we haven't quite got.
And so we are out of time. So I would like to thank you all for coming. It was a wonderful discussion. And I guess I would also leave with one thing that I'm involved in an oral history project, and I think you actually were interviewed by fourth year medical students doing as part of the geriatrics rotation. And the students record a session hearing about the life of folks who have volunteered to participate. And the last question is, what can I do to be a better doctor? And across the board, we actually have just collected all the clips of people saying this and created like a little mini audio or podcast. Can you guess what they say? Listen.
Surprise.
And on that note, it's how you listen. Are you going to stand at the door? Are you going to come and sit down? You don't even have to hold my hand because we're afraid of touching now. But, to really listen. Right. It seems so simple, doesn't it? But still physicians don't do it. They'll lean against the door and all, but that eye contact and sitting on your level makes me feel like you care whether you do or not.
It doesn't take any more time to sit down.
And take a rest, get a seat.
So thanks. And there is food in the back, so I would invite you to grab some.
Magically appearing.